Welcome to the ultimate NClEX master guide on heart failure. In this deep dive, we will cover everything from pathophysiology to nursing interventions. First, let's clear up a common misconception. Heart failure does not mean that the heart has stopped working entirely. That would be cardiac arrest. Instead, it means the heart muscle is either too weak or too stiff to pump blood effectively. It cannot meet the metabolic demands of the body. As a result, the body starts struggling due to poor circulation and a lack of oxygenated blood reaching vital organs. Heart failure is generally divided into two main types, left-sided and right-sided. Understanding the difference is crucial for your exams. Left-sided heart failure is the most common type. Here, the left ventricle fails, causing blood to back up into the lungs. Because blood backs up into the pulmonary system, you will see respiratory symptoms. The patient may experience dyspnea or shortness of breath. When you auscultate the lungs, you will hear crackles, which are caused by fluid in the alveoli. This is a classic NClEX sign. In severe cases of pulmonary edema, the patient may cough up pink, frothy sputum. This is a medical emergency that indicates extreme fluid backup. Watch for paroxysmal nocturnal dyspnea, where the patient wakes up gasping for air at night, or orthopnea, needing pillows to sleep upright. Now let's look at right-sided heart failure. In this case, the right ventricle fails and blood backs up into the systemic circulation. Because the backup is in the body, you see swelling. Peripheral edema in the legs and ankles is one of the first signs you'll notice. You may also see jugular vein distension, or JVD. This occurs because the right side of the heart can't handle the incoming venous return. The backup can lead to an enlarged liver, known as hepatomegaly, and fluid accumulation in the abdomen, called ascites. Consistent weight gain is a critical indicator of fluid retention in right-sided heart failure. Remember to monitor this daily. What causes the heart to fail? The most common cause is coronary artery disease, which limits oxygen to the heart muscle. A myocardial infarction, or heart attack, can leave the heart muscle permanently damaged and weak. Chronic hypertension is another major factor. High blood pressure forces the heart to work harder, eventually leading to stiffness and failure. Let's look at the pathophysiology. When the heart is weak and cardiac output drops, the body activates the RAAS system. The kidneys try to help by retaining sodium and water to increase blood volume, but this actually makes the heart's job much harder. Blood vessels also constrict, which increases the resistance the heart must pump against, leading to a vicious cycle of fluid overload. Medical management is a core NClEX topic. Diuretics like furosemide are the most important medications to remove excess fluid. When giving Lasix, you must monitor potassium levels. These drugs can cause life-threatening hypokalemia and dehydration. ACE inhibitors like enalapril or lisinopril reduce the heart's workload. Be aware of the common side effect, a persistent dry cough. Beta blockers like metoprolol slow the heart rate to improve function. Do not give these if the patient's heart rate is already too low. Digoxin is used to strengthen heart contractions. It is a powerful drug that requires careful monitoring. NClEX Gold, always check the apical pulse for a full minute before giving digoxin. Hold the medication if the heart rate is below 60. Watch for signs of digoxin toxicity, including yellow-tinged vision, nausea, and an irregular heart rate. This is a common exam question. Nursing care focuses on fluid management. Restrict fluids as ordered to prevent further overload on the heart. Daily weight is your most important indicator of fluid status. Remember, 1 kilogram of weight gain equals 1 liter of fluid retention. Education is key. Teach the patient to follow a low-sodium diet and avoid processed foods, which are high in salt and cause water retention. Positioning can save lives. Use the high Fowler's position to help the patient breathe more easily and improve oxygenation. Patients must know when to call for help. Sudden weight gain or severe shortness of breath are major warning signs. Chest pain, confusion, and the appearance of pink frothy sputum require immediate medical attention. Do not wait. Let's use a memory trick to keep it straight. Left-sided heart failure means the lungs. Just remember, L equals lungs. Right-sided heart failure means the rest of the body. Think of the swelling in the legs and abdomen. Right equals rest of body. Here's a quick comparison. Left heart failure shows respiratory symptoms like dyspnea and crackles due to pulmonary backup. Right heart failure shows systemic symptoms like edema and JVD. Use this table as a quick reference during your final review. You are now equipped with the core knowledge of heart failure for the NClEX. Review these concepts often, and you'll do great. Good luck.